So good evening, everyone. Let us start our unknown class today. We completed up to aphorism 5 yesterday. That is about the cause of the disease. And today we will be talking about the portrait of disease, that is aphorism 6. This is all under the blueprint of case taking. So before going to portrait of disease, aphorism 6, let us just see the evolution of aphorism 5 in a quick reference from the appendix. So just a very small line. This aphorism 5, just see appendix to aphorism 5. This aphorism appears first time in the 4th edition. So what we discussed yesterday, aphorism number 5, it just came from the 4th edition onwards. And not much of the details of it. It is as it is 4th edition onwards. And now let us just have a review regarding the aphorism 5. It is regarding the cause of the disease. We should, every case of disease coming to us, we must understand if it is an acute one, go for the occasion, go for the most probable exciting cause. And if it is a chronic case, the job is to reach up to the fundamental cause, that is the chronic miasm. For that, you have to note down the most significant points in the whole history of that chronic disease. And there are 7 points which we discussed yesterday very elaborately, in which we are to get these causes. The first one is the physical constitution. The second one is moral and intellectual character. The third one is occupation. Fourth one is mode of living and habits. Fifth one is his social and domestic relations. Sixth is age. And seventh is sexual functions. If you find any other, you can add, because etc. is given here. And we discussed about their detail in what each one we can go into to find out the cause. Because the cause is useful to assist the physician for the mission care. This is the purpose. Don't misjudge that find the cause and prescribe. This is what not Hahnemann told here. It is going to assist the physician for the mission of care. See the first line of aphorism. Useful to the physician in assisting him to cure. This much is the understanding. Let's go further about the aphorism 6. Now, in the 6th aphorism, as I told you, a very small caption that it is about the portrait of the disease. If you see in the table of contents, the table of contents says, for the physician, the disease consists only of the totality of its symptoms. It has a footnote. The table of content, just summarize and give a synopsis of it, is footnote of the sixth aphorism is the old school's futile attempts to discover the essential nature of disease, that is in bracket prima causa. So this is what we are going to know, that exactly what is being described in aphorism 6 is regarding the portrait of the disease. And in aphorism 7 he describes about the totality of the symptoms. First of all, contrary to the belief everyone was having till date, that portrait and the totality is one and the same thing. No, my dear friends, it is not one and the same thing. This we will learn. Let us first understand what is portrait. So let me start. The unprejudiced observer is a big hyphen here, well aware of futility of transcendental speculations which can receive no confirmation from experience, be his power of penetration ever so great, take note of nothing in every individual disease except the changes in the health of the body and of the mind. And just we stay here and we just try to understand what is he wants to say us. He says unprejudiced observer. Let us understand the word unprejudiced. This word unprejudiced is made up of combination of three words. One, unprejudice. Un means no. Un means not. Un is saying something. What you're saying, you just make the opposite meaning of it. Un is a prefix. So unprejudiced is a word which is telling us something. To understand this, very simple. This word is made up of three different things. One is a prefix un, which means not. Pre means prior. Judice means judgment. So let us understand then what is prejudice. Very simple. Prejudice means pre-judgment, prior judgment. A physician should not do this. Hence he wrote un. Unprejudiced means do not judge beforehand. No prior judgment. Got it? No prior judgment is the meaning of unprejudiced. So, somebody who is working as a homeopathic physician, who is working as a physician, whatever may be the stream it is, he must be an observer first. Observer is a subject, a noun, who has a capacity to observe. Observing is a very instinctual nature of every human being. When we say observer means the one who is observing. What is observing? When your mouth is shut, but your eyes are open. When your ears are open. When your sense of touch is very sensitive. Even in the situation when it is required regarding the taste, that is quite intact. My point is that you're not using your vocal cords, but you're extremely sensitively using all your five senses. The one who is utilizing his five senses is an observer. We all see the very small kid. If you give him something, some 2 months, 3 months, 5 months aged kid, if you give him something, he will try to observe, taking everything to the mouth. That is his laboratory to learn about the world. So that is why I am saying that you hearing me? That is why I am saying that observation is a very inherited quality right from the birth. Even if you go into the understanding of intrauterine life, the senses start working quite early within the womb. So observation is one such thing when you're utilizing your senses. But then it is not this much. Observation is not this much. When you are utilizing all the five senses and you are able to make out some kind of similar things, some kind of opposite things, since you are observing colors. Just imagine how you go for a shopping. I hope so many of you were missing very badly nowadays. So when you're going for a shopping and you are hunting your color, you are hunting your yellow, you are hunting your blue. So this is what something the part of the observation, especially division. So like this, everyone, everywhere, some or the other way, is utilizing his inherited quality of observation. Observation is the understanding about an event, about something after collecting the data from your senses. What you understand out of that. So this understanding regarding the uh, event after utilizing the relevant five senses. I'm saying relevant, I mean regarding the event, which sense is more relevant? If it is some, say, some song, then your sense of hearing is more important. If it is regarding some dance, it is related to your vision. If it is related to the texture of some object, then your sense of touch is more important. Like this. So, once we understand that what is observation, here Hahnemann wants to say that if you really want to be the physician who is looking for the cure of the patients, he must know the observation. Here, this observation is related to the understanding of the patient. How will you understand your patient? So, while case checking are all senses, obviously, here the sense of taste is not that much utilized. But then the most utilized sense is your eyes, that is your vision, and your hearing. And at the same time, your sense of olfaction, your sense of smell must be very acute while examining the patient. When I say it should be very acute, because you should be able to differentiate. First of all, you should be able to observe that there is some smell, and then your sense of olfaction should be so acute that you should be able to make out. So the need is to be the physician. He must be an observer. Though the observation is a inherited quality, still we need a proper training. Whatever the job, whatever the working we undertake, the sense of observation is required, which is gifted by the Almighty. But then, as per the job, as per the activity to be undertaken, it requires a proper training for it. Hence, the same is to be done for the physician. We go to the OPD as a junior doctor, we go to the IPD as a junior doctor to observe and learn observing from our very senior physicians. We are taught that, see how patient was sitting or lying in the bed. We are taught that how the patient is behaving while talking to the physician, how he is behaving with the surroundings around. Somebody is sitting, how is he behaving? If somebody is accompanying the patient, maybe some family member, we observe how he is behaving and how he is reacting to the behaviors of the others. So, in this understanding, in this looking into the patient and his behavior, we need the observation. And since it is already gifted, the requirement is a proper training to that. Here, I wish to refer you one very, very important lesser writings, that is the medical observer. It is a small article. So we need to read that article, understand that article, and know and find out many other sources. All our clinical textbook, clinical medicine textbook like Hutchins and all, are the sources for us to know how to be a medical observer. Then only we will be able to learn thereafter, after being an observer, that I am not to be a prejudiced observer. I am to be unprejudiced observer. But I simply understand and try to make you understand that instead of going so much of philosophical explanations of unprejudiced, those who have been with me in the journey of author's introduction, how the old school was having a notion of pre-deciding everything. No physician should decide in advance regarding the knowledge of disease. When a patient coming, sitting in your clinic before you, and you see him and say, I understood what is the problem. I know you are suffering with thyroid and I am giving you the medicine. You need not to say so much. Anyway, this may be possible. Seeing the patient and all that, you are reaching to know that what could be the diagnosis. But for a homeopathic physician, this much is not enough. We are to reach a similar remedy. Then, what is his specific hypothyroidism? That we need to learn. So, whatever may be the case, whether it is acute or chronic, your observation is must. But at the same time, it should not be just making a judgment in advance. You should not make any judgment in advance. I saw you, I got it, you are Calcarea first. I saw you, hence you are Calcarea. Not really. This is not the right way to do things, to do homeopathy. I can remember one instance with my teacher, Dr. Elim Khan, and he was telling us an incident when he was sitting with his guru, Dr. Gyan Majumdar, who was one of the most learned personality in homeopathy in Kolkata. He asked his teacher, see how the very fascinating story is that my teacher is asking his teacher that tell me that which mistake I should never do in my professional life, in my practice. He told him, it is all very good. You have very good knowledge of organon, materia medica, everything. But always listen the patient and after that prescribe. You might be having this power that seeing the patient and prescribe, but don't do this. See, this is what is something pertaining to the unprejudiced observer. And I know myself for last some 30 years, and always I observe, I always see him seeing the patient, though he understood the remedy just by one glance of the patient. But then still, he always listen the patient, understand the patient, find out all the details, looking into his papers, medical papers and all. And then after he says, all right, this means. So my point of view to make everyone listening me to understand that the homeopathic physician has to be the observer, and to be observer, he must read the medical observer by Dr. Henman and many other such texts which can give us a training to be a medical observer. Then, even though we know everything, we still have to be unprejudiced, means no such judgment in advance regarding the disease, regarding the remedy. Because if you judge beforehand everything, the mistake is most probably going to occur. And such mistakes going to ruin the patient. So what I wish to make every one of you understand that instead of going into so much of philosophical understanding of the word unprejudiced observer, take it very simple. First, that we need to be an observer, medical observer. And after being the right medical observer, this physician has to become unprejudiced observer. What is the meaning of unprejudiced? Means not to judge in advance. Do not judge in advance. The patient comes, whatever is the thing you note down, you write down your observations, but just afresh you listen him. What is he saying? You properly listen. You properly listen the attendants, family members who are accompanying the patient. And of course, all your observations to be taken into the account, write down on your case sheet. This is what is the first thing the physician should do while case taking. Then he is using the word the unprejudiced observer, well aware of futility of transcendental speculations. What is this transcendental speculations? You understand the word meaning of futility, that means the uselessness. Transcendental means which is something super sensual, that is something beyond the scope of senses. Which is something cannot be described and observed by the senses is transcendental. Speculations, you understand, when you do any guesses. So he says, no such old school physician's business to be adopted. If you are coming from that area, you just shun away those kind of activities in which you are doing some speculative understanding regarding the case, which is not having any confirmation with the senses, because it is not confirmed with the senses, it will not be confirmed with the experience also. So anything, if you really want to do in the medicine, in the homeopathy, it is to be understood with your five senses. And on that basis, you should be able to experience them. But anything which is a guesswork cannot be confirmed with the experience. That is why he says to be an unprejudiced observer, physician, homeopathic physician, whose jobs, whose mission is cure, he will be an observer who is not going to decide anything, who is not going to judge anything in advance. Then what will he do? Again, he says, be his power of penetration ever so great. As I give you the example of my sir, he has such a gaze, he has such a power of penetration. Even then, such physicians, what they have to do? They have to do nothing. He says, takes note of nothing. How how he wants that more and more learned you become, more and more chances to be the judge who is going to decide things in advance. This is the difficulty having so much of knowledge, having so much of all the things. So, such person, that such knowledgeable person is required. But then, in every case, he will be only called unprejudiced observer when he's not really judging anything in advance and he's not writing anything on the paper. Take note of nothing. In every individual disease, except, do not note anything except. That means now he is going to tell that such a powerful, penetrating, observing physician, what he has to note, what he has to note, the changes in the health of the body and of the mind. This is what such a learned physician has to do. He only have to note down the changes in the health of the body and of the mind. He has to note down that what are those changes. You need to find out that one line of demarcation when there was harmony, and since when no harmony, since then you are to note down when this disharmony started. I told you the understanding of harmony and disharmony, that when you start feeling conscious of your any of the body part, any of the body function, when you get conscious about it, that consciousness, what are the changes? What exactly the changes? What is he saying? Those changes, this kind of physician who is unprejudiced observer will take noting of it. In that he says, first, the changes in the body and the mind. Because patient is mostly able to tell things in this manner only. Because the gross is seen first, the subtle is seen later. Gross is so much easily seen, so much easily observed by the patient, by the family, even by the doctor. But then mind is quite subtle. So any such physician who is so sharp, having such a penetrating senses, knows everything as soon as patient is coming before him, having such a powerful observation, such a powerful observer, he has to note nothing except the changes in the health, in his body and his mind. Those changes you are to note. And how will you note all this? Such kind of presentation of this changes in the health of body and mind are mostly presented in this fashion as written in the brackets in italics. Morbid phenomena, accidents, symptoms. Now, Any patient coming to you, he just come and say, see, Dr. Saab, I am here. For example, a female case comes that I have noticed since last two periods, I bleed a lot, excessive bleeding. Maybe for that, he is presenting some ultrasound reports, which is showing some kind of fibroids or some kind of cyst or something. So this is how the patient comes with the complaint and with the supporting document. Maybe with the document, or first time directly coming to you, he's just presenting you the clinical feature. What is this? Morbid phenomena. Phenomena is an event, a situation, a condition. Morbid means sick, sick phenomena, sick event, sick situations. He may be coming and telling you, just see my hand, I have such a big wart here. What is this? Nothing but morbid phenomena. Dr. Saab, I have got pain here. This. What is this? Morbid phenomena. It may be quite a massive, uh, presentable tumor, maybe a small symptom. But then every patient is presenting like this. He present things, and that presentation, this presenting complaint is nothing but the morbid phenomena. Then you ask when it has happened. He might tell some kind of presentation of it, some kind of beginning of it. How does it begin? It begins with some kind of incident. It may be some kind of physical incident. It may be some kind of emotional incident. Having such kind of incident is called accident. I had this setback because of some problem in the business of my husband. Since then, this bleeding started. Maybe I fell off from the two-wheeler. Since then, I'm not well. What is this? This is accident. Then she will be telling you the symptoms that when I'm going to start with my periods, I came to know beforehand. How? Because I start with a severe busting pain in my sacral region as if it will tear apart, like we read in Trillium and such medicines. So this is how it is presented by the patient. And this is the way such a physician of the highest rank observer, having such a penetrating senses, has to note down. Once you note down this, what next? All these things which can be perceived externally by means of the senses. With your senses, you can understand what patient is presenting to you. Is all under the purview of your all the five senses. Then he says, "Oh, you did not understand," or okay, wait. I just give you little more elaborate expression. What I have said to you, anyone says, I give you little more elaborate explanation. That is why he says, that is to say, I mean, I give you more elaborated expression. What I want to say to the unprejudiced observer, he notices only the deviations from the former healthy state of the now diseased individual. You have to find out since when. We always say in teaching for the clinical class in the case taking, the first thing is note down presenting complaint. Finding out presenting complaint, you need to find out since when this complaint started. Means we need to know for how long he was all right and from what time he felt sickness. I said line of demarcation of the health and the sickness. This you need to find out, then only you will be able to note down the deviations from the formal healthy state of the now diseased individual, which are now note, which are felt by the patient himself. Such deviations to be noted, which are felt by the patient himself, remarked by those around him, means the family members, maybe some servant, maybe some attendant, maybe some whatever who is a friend, who is very near to the patient, remarked by those around him and observed by physician. So, noting down the symptoms have got three sources. First source is patient himself. The second source is the family or the attendant and the friends of the patient. And myself, the physician, is at the third number. And it is important to note in this order. Whatever patient is saying has to be given the prime importance. Then second number importance is the family or the people around. My as a physician observation is at the third point. But then all three are important. Write down them on your paper. Then to do what? All these perceptible signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of the disease. So, all the deviations from the healthy state to the sick state, those deviations in the body, in the mind, noted by the physician, noted by the patient himself. Then all these deviations in the body and mind, noted by the people around, maybe family members, servant, friend, whosoever people mostly around him, those observations. And then finally, yourself as a physician, what you are observing, note them, write down them. When you get all these details together, when you write down everything, this is the total final symptoms available, perceptible signs represent the disease in its whole extent. These are the signs. Here, sign means that all signs and symptoms. Perceptible means which you can perceive. You perceive with your senses, perceived by the patient himself, perceived by the people around him, perceived by the physician who is seeing him. All together shows that this is the all signs and symptoms related to the disease in complete extent, in whole extent. That is, that means together they form the true and only conceivable portrait of disease. This is the portrait of the disease. That means the portrait means all those symptoms together noted from the deviations to the sick state in the body, in the mind, noted by patient, noted by surrounding people and the physician. You write down 1 to 100, whatever it may be. This is called portrait of disease. This is the first and very, very simple understanding regarding the knowing about portrait of disease. Just we just keep it up to here learn this much, we'll be going into further details of all these things, including the footnote of this aphorism. And again, he is going to remind us something as told in the footnote of the first aphorism, that how physicians should not go too much into the interior of the operations of the vital force, because they are not going to help so much. So we will be uh, catching up tomorrow further on the discussion of aphorism 6 and its footnote. And any questions you can write me now, or you can write me in the WhatsApp group, or somewhere in the comment section of the uploaded video. And I hope the very first understanding you are able to note down in your mind, what is this unprejudiced observer? That means a physician has to be medical observer. Read Medical Observer by Hanman. And to be observer, you need to use your senses, give training to your senses to be a physician. And such observer has to be unprejudiced. That means do not judge in advance. Do not do any judgment regarding the patient in advance, regarding the diagnosis of the disease, regarding the selection of the medicine, or regarding the proper dose of it. Do not do this in advance. Maybe you are very, very highly penetrating senses and you understand so many things. Even then, whenever you see a case, do not note anything except the changes beginning when he is deviating from the health to the sickness. You have to note down the changes in the body, in the mind. How, in what order? As told by the physician, as told by the patient, I'm sorry. Then his people surrounding the patient, that is family, friend, or so. And then it is your turn, you note down your observations. What you observe maybe in the first glance of the patient. Note down now. All together is called portrait of disease. This is what just you keep in your mind. When here, one comment by Dr. Puja, that what is meant by author here with the whole. When he says whole extent, he meant that all those symptoms noted, the deviations in the patient, body and mind, by patient, told by the patient, by his family members, and observed by physician. Altogether is whole disease. Beyond this, there is no more disease. Does not mean that after noting down all this, still you need to go into the so many of experimentations and number of tests regarding the patient. If we are depending on the medical test, that means we are not able to really judge the patient, really observe the patient clinically. And it is very clear cut understanding. If you go into the British School of Medicine, they are more towards the clinical examination and the clinical observation of the patient. Instead, the other school, that American school, they are into the test. Go and see what are the changes in the MRI or this or that. We as a homeopathic physician need to understand clinically. And what you note clinically in this fashion, as told here, is the whole disease you know in its full extent. As such, no more understanding by any other sources. This much is enough. Maybe, but then patients cannot speak, family members tell. Not speaking itself is a symptom. You are getting so much of observation. So, this is all quite possible. Patients are not speaking. But then, those patients who are able to speak but not speaking, Find out what are the inhibitions he's not speaking to you. Maybe one daughter-in-law not really explaining the complaints because she's finding the other side mother-in-law is sitting out of the modesty, out of the respect. She will not speak much. You have to give that congenial atmosphere so that patient can talk to you freely. No other way for us. So just see, do all these things. So anyway, let us sign off today, and we'll catch up tomorrow. Then by that time, just collect your questions, get your questions, and we will be answering them all tomorrow. Thank you everyone for listening me patiently all along. Thank you so much.